It's Wednesday, April 22. This is the news on PBCJ. I'm Carol Francis. The delay in getting samples back from the field quickly enough to capture a real-time picture of the spread of COVID-19 in Jamaica has been minimized with the commissioning into service of the Gov't 6800 diagnostic machine at the National Public Health Laboratory in Kingston. Marlon Samuels has more in this report.
Blood tests for the coronavirus antibodies is reportedly an essential tool to assess the reach of the COVID-19 pandemic. The need for increased testing came with the discovery of a hotspot or workplace cluster in St. Catherine.
Over the last week, you know that we have come under a lot of pressure with the amount of samples that have been taken coming out of the workplace cluster that we've had in St. Catherine. So just between those persons that are tested, over 700 persons, plus their contacts, almost 1,000 persons tested.
To better measure the extent of the outbreaks, there needed to be more testing.
We have made several inroads into boosting the sampling capacity out in the field. We have been getting the samples coming in from the health centers, from the different hospitals of all persons who have any kind of respiratory illnesses. And we have also started using the mobile team that is helping the health departments in getting the sampling done, and this is going to be particularly useful when we have any kind of outbreaks in communities and we need to do the contact tracing and we have to do the testing at the same time.
This is now possible with the Gov't 6800 diagnostics machine. It is a molecular testing system which allows the National Public Health Lab to expand its testing capacity. The machine is capable of analyzing up to 1,000 samples in a 24-hour period.
380 samples tested every 8-hour shift, and you can go 2 shifts or more. So depending on the demand, you could go over 1,000 on a particular day. So I mean, that's a very welcome addition to what we have already in place, and I think it will certainly increase the testing, and of course in deploying the mobile units to go out, as well as the different testing protocols that we have. What we have effectively done is created the capacity to collect more samples nationally, whether it is through contact tracing or whether it is through our sentinel sites, meaning persons just turning up at the hospitals or the health centers. We are in a situation now where we can do significantly more testing, and that's a very positive development for testing of samples in the country.
For the news on PBCJ, I am Marlon Samuels.
As of Wednesday morning, there were 10 new cases of the COVID-19 in Jamaica, which brings the total number of cases in the island to 233.
So we have gotten back results of our testing of a number of our Ministry of Health staff. As you know, we had a situation recently where one member was tested positive, which led to a series of events, contact tracing, notices for quarantining of some staff members, deep cleaning of the offices in the New Kingston area and its environs. We have tested quite a number of staff members, and the results have come back to date, where 5 additional members of staff have been tested positive for COVID-19. So it brings the grand total to 6. What that means is that we're going to have to trigger, and we have already triggered, another series of events around contact tracing, around counseling, around further deep cleaning, depending on where these persons were located, and isolation and treatment, of course. We take our mission for the country very seriously, but we also recognize that the Ministry of Health personnel, who are the front line of the COVID battle, where the country depends on them, we have to pay particular attention to ensure their welfare and well-being so that they can carry out the job that is necessary on behalf of all of us.
In a statement on Wednesday, BPO company Alorica says it remains committed to the safety and health of its employees in Jamaica. Some 123 employees of the company have tested positive for COVID-19. Simone Absalom has that story.
The Portmore branch of BPO company Alorica has become a flashpoint for the COVID-19 outbreak in the island. To date, 123 employees have returned positive tests for the virus, and employees at the company have been subjected to public persecution and judgment. However, in a statement released on Wednesday, the entity gave its version of the events. Alorica says that during their most recent health inspection conducted on April 1st, 2020, the Ministry of Health and Wellness declared their Portmore facility fit for operation. PBCJ News showed the report in our newscast on Monday. The company says after receiving confirmation that one of their team members tested positive for COVID-19 at the Portmore campus on Friday, April 10, 2020, they immediately closed the site to protect team members and to stop the spread of the virus within the community. The Ministry of Health and Wellness then began testing team members starting Saturday, April 11, 2020. The company says it took the further step of voluntarily closing their Kingston campus, even though no employee from that location had ever tested positive. Alorica says it has continued to take steps to protect its team members and the Jamaican community, and to cooperate with the Ministry of Health and Wellness, supporting its efforts as that ministry leads the testing and quarantine of their employees. For the news on PBCJ, I'm Simone Absalom.
The umbrella body that represents Business Process Outsourcing, or BPOs, the Global Services Association of Jamaica, says it is standing in solidarity with the government's decision to close BPO sites for a period of 14 days. The measure, announced by Prime Minister Andrew Holness on Monday, takes effect today, Wednesday, April 22. Association President Gloria Henry says its members, which account for over 31% of the full-time workforce, are in work-at-home solutions. Parents of students at several prep schools in Kingston and St. Andrew are against paying full or barely reduced fees for the upcoming school term. The term will be executed via distance learning or homeschooling, owing to the physical closure of schools because of COVID-19. At a virtual press conference on Monday, Prime Minister Andrew Holness said that schools will remain closed until May 31.
Educational institutions are to remain closed up to the 31st of May 2020. I want to be clear. I'm not saying that there will be no school. The physical place of learning, the school, will remain closed, but education will continue online or remotely.
Some schools have issued letters advising parents of discounts ranging from 5 to 20%. The parents, some of whom have had their wages slashed or have been out of work for the past month, either from layoffs or closures, argue that those figures are unreasonable in light of the economic downturn. They argue, too, that the hairline discounts does not adequately take into account the physical closure of the school plant or the reduced involvement of teachers in the distance learning model. And Prime Minister Andrew Holness has issued a strong warning to criminals intent on destabilizing the country during the COVID-19 crisis. The warning was made during his address in the House of Representatives on Tuesday during the debate on 4 resolutions to extend the states of emergency, or SOEs, now in force across several parishes for further 90 days.
The level of intelligence that we are picking up shows that there are persons in our state, and I'm not saying that this is any political thing, there are people who are trying to find routes, and they feel that a route is through Jamaica. And if they can weaken the state, if they can corrupt our police, if they can corrupt our public officials, they will. And I want it to be clearly understood that this government will take all measures to ensure that the the point I'm making is that sometimes we are not seeing the hidden threat. And they are here, and they are very active, and they are smart. These are people who are well educated, they have access to resources, and they will try subversive activities. And so we always have to be on guard for these kinds of activities.
Opposition leader Dr. Peter Phillips made the call for an island-wide state of emergency to effectively manage the COVID-19 pandemic and the ongoing crime crisis in the country.
The fact is that the emergency regulations allow for the promulgation of a state of emergency that where there is widespread pestilence, I think is the use of the word, in the relevant section of the Constitution. So what arises then is whether it is tidier and more effective to promulgate a state of emergency, bring the regulations under the Disaster Risk Management Act into force under that promulgation of a state of emergency, give it island-wide coverage, and enable the unified fight, if that is what you seek, of both the disease, COVID, and the crime efforts that might arise.
In seeking support for the measures to extend the SOEs, the Prime Minister disclosed that there is a reduction in serious crimes based on figures for the period January 1, 2020 to April 15, 2020 in comparison to the same period last year.
Mr. Speaker, each police division recorded similar reductions during the SOE when compared with the immediately preceding period. So in that entire state of public emergency, the police division of Clarendon, murders have reduced by 45% and shootings by 57%. The police division of St. Catherine South, murders were reduced by 33% and shootings by 35%. And in the police division of St. Catherine North, which benefited from an SOE before, which significantly brought that area under control, there was a marginal reduction in shootings of 3% and a significant reduction of 17% in shootings.
The measures were passed with 44 members voting in favor and 2 against. Responding to concerns about a hike in electrical bills, the Jamaica Public Service, JPS, says residential customers have increased their consumption of electricity since the start of the COVID-19 outbreak by approximately 3%. This, the company attributes to the fact that many are spending more time at home. The JPS, in a statement, explained that people who would have been out of the home working for at least 8 hours are now working at home alongside children who are being homeschooled. The Ministry of Tourism today launched free online training programs for tourism workers affected by COVID-19. The programs being undertaken in collaboration with employers supports the development of people in the tourism sector by offering opportunities for them to achieve certification. The 8 online courses which are being offered free of cost include guest room attendant, public area sanitation attendant, laundry attendant, kitchen steward and porter, certified banquet server and basic supervision are being offered by Heart Trust NSTA. The National Restaurant Association, NRA, is expected to offer Serve Safe, a course for every person in the hospitality sector. The American Hotel and Lodging Educational Institute will be on board to provide a certified restaurant server course. All courses will include certification examinations. Successful candidates will receive certificates from NRA, the American Hotel and Lodging Educational Institute, or Heart Trust NSTA, as required. The government is making arrangements to repatriate the 43 crew members aboard the Marella Discovery 2 cruise ship, which is now docked in the United Kingdom. The ship was in Jamaican waters for refueling on April 2 when a request was made for the Jamaicans on board to disembark. The vessel left before the government's approval could be conveyed. The vessel is currently anchored at a port in Southampton in the United Kingdom.
I want to assure you that we are in touch with all our stakeholders, including the owners of the cruise line, about arrangements to bring those 43 workers home, as well as an additional 73, as well as an additional 30 that have been identified as non-essential crew, which they therefore would not require to keep the mechanics and of the essential services of the ship together and functioning. So we have decided as a government that we will engage with the owners of the line to bring those persons home.
46 deportees arrived in Jamaica from the United States on Tuesday. The Ministry of National Security says the Jamaican nationals will undergo a COVID-19 screening and be quarantined for 2 weeks in a facility designated by the government. The Ministry of Health and Wellness has conducted sensitization sessions with staff at the facility, detailing potential health risks of COVID-19 and how to detect and report signs of the virus. At the end of the quarantine period, those who are cleared by health officials will be released to family members. Opposition leader Dr. Peter Phillips and Member of Parliament for Manchester North East, Audley Shaw, both of whom recently underwent surgery, were welcomed back to the House of Representatives on Tuesday afternoon. The People's National Party earlier this month revealed that Dr. Phillips had been diagnosed with stage 3 curable colon cancer. He underwent surgery on March 23. All cabinet members have been tested for the coronavirus COVID-19, the results of which are negative.
You may have noticed that we did not have our usual press briefing. That is because we all got tested. All the cabinet members got tested, and a few of our permanent secretaries took advantage of that opportunity. We put in place measures at the Cabinet Office, the OPM, and all ministers have been directed to ensure that the measures that they have in place are tightened in the ministry and around their personal security, and health security, that is. We took some time to reflect on our own circumstances and operation to ensure the continuation of government in a time of epidemic. By the way, so the results, we've got back the results, all negative.
Curfews, lockdowns, and testing 1,000 people per day. Those are some of the measures being implemented to curtail the spread of the coronavirus COVID-19. It has also become mandatory that Jamaicans wear a mask in public spaces. This week on Living Healthy, we'll learn about face masks from Simone Absalom.
Public health authorities believe masks can curb the spread of the coronavirus because they are effective at capturing droplets, which is a main transmission route of the virus. There are 3 main types of masks: the filtering face piece mask, or FFP, the surgical mask, and the homemade mask. The FFP fits around the nose, mouth, and chin and filters out the tiniest particles. Some are made with an exhalation valve that makes breathing easier, but it increases the risk of the virus escaping, so it's only protecting the person wearing it. The surgical mask consists of several layers of paper or non-woven fabric with a thin wire to make it fit over the nose. When the wearer coughs or sneezes, it blocks the droplets, but air flows out of the sides, so it's mainly protecting others rather than the wearer. At present, there is a shortage of surgical and FFP masks around the world, so there is an increased demand for homemade masks. They can be made from handkerchiefs, t-shirts, and even paper. A paper mask only blocks 1/3 of the droplets. A cloth mask can be washed and reused. But masks must be used alongside thorough hygiene measures like not touching the front of your mask while wearing it and washing your hands or sanitizing them before and after you use it. You should also practice physical distancing. How to wear a mask. Before putting on a mask, clean hands with alcohol-based hand rub or soap and water. Cover your mouth and nose with mask and make sure there are no gaps between your face and the mask. Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. To remove the mask, remove it from behind. Do not touch the front of the mask. Discard immediately in a closed bin. Clean hands with alcohol-based hand rub or soap and water. Replace the mask with a new one as soon as it is damp, and do not reuse single-use masks.
Let's now join Gabrielle Thompson for the business report.
In Tuesday's trading session, the JSE Combined Index declined by 484 points to close at under 400,000 units. Overall market activity resulted from trading in 75 stocks, of which 31 advanced, 33 declined, and 11 traded firm. The Junior Market Index declined by 9 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, Access Financial Services Limited, and AMG Packaging and Paper. Stocks declined for 1834 Investments, Burrito Investments, and Blue Power Group. Trading firm were Siboney Group Limited, Derrimon Trading Company, Preference Shares, and Dolphin Cove Limited. Trans-Jamaican Highway Limited was the volume leader with over 30.2 million units, followed by Mailpack Group Limited with over 6 million units, and Trans-Jamaican Highway Limited US dollar with over 2.2 million units. Now for the foreign exchange. The US dollar on Tuesday, April 21, ended trading at $139.65. The Canadian dollar sold for an average $100.82. The pound sterling traded for $173.72, and the euro ended trading at $151.68. Oil prices slumped again on Wednesday, with Brent falling to the lowest since 1999 as the market struggled with a massive crude glut amid a collapse in demand for everything from gasoline to jet fuel caused by the coronavirus outbreak. Brent crude futures slid $2.70 to $16.63 a barrel, and West Texas Intermediate crude fell 68 cents to $10.89 a barrel. And that's it for the business report on PBCJ. I'm Gabrielle Thompson.
In regional news, Director of the Pan American Health Organization, Carissa Etienne, is urging the Caribbean to expand its COVID-19 testing capacity. We get more from this Barbados Today report.
The Caribbean is being urged to accelerate and expand testing for COVID-19. The recommendation from the director of the Pan American Health Organization, Dr. Carissa Etienne, who also said it was vital for all countries to actively embrace preventive measures while preparing for more cases, hospitalizations, and deaths. Dr. Etienne suggested that the numbers being recorded were not a true reflection of how widespread the virus was in the region and in Latin America.
We are fighting an invisible enemy, not just because the virus can't be seen with the naked eye, but because we don't have a full picture of how COVID-19 is affecting our societies. This must change. We need a clearer view of where the virus is circulating and how many people have been infected in order to guide our actions. It is important to accelerate and expand testing to track the spread of COVID-19 in the Americas. Expanded and decentralized testing will help us better monitor the trends of the pandemic within each country. This also helps governments introduce, reinforce, or adapt public health measures such as social distancing. Expanded testing will also allow local health authorities to implement and strengthen contact tracing, to quickly isolate suspected cases, and to break the chain of transmission in communities.
Addressing PAHO's weekly virtual media briefing on Tuesday, Dr. Etienne conceded that ramping testing capacity for COVID-19 was a challenge for many countries in the region. However, she said the organization was working closely with countries to address the situation.
In these challenging circumstances, what do we as PAHO recommend to our countries? First, expand lab capacity. Countries are encouraged to scale up testing for COVID-19 by using all of the public and private laboratory capacity available at the national level. Second, prioritize according to availability. When there are limitations, we need to prioritize patients with symptoms, contact trace, and follow up with those that may be infected. Third, ensure access to all. Testing should be free of charge to patients. High prices create a barrier between a patient and the treatment that he or she desperately needs. We need to expand access so that everyone who needs a test gets one. PAHO will continue to work with member states to make these recommendations a reality.
The Education Ministry in Guyana is working on a comprehensive long-term plan to ensure that students are not left behind during the COVID-19 crisis. We get more in this report from InfoHub.
Since the reopening of school has been suspended until a time that is safe for students and teachers, the Ministry of Education is working to ensure that all learners can thrive through the challenges and continue learning while at home. While emphasizing that the entire world is facing unprecedented changes in every sector of life, Director of NSER Jennifer Cumberbatch said in a virtual interview that the ministry is working on finalizing a date for the NGSE examinations.
We are considering several options because the whole thing is that we really don't know what's happening down the line. So we have options for if school reopens on such and such a date, we are going to then give the date a few weeks hence and so on. So there are options that we are still looking at because, as I said before, the situation is not one that we have encountered before, but we are planning that once we know when school is going to reopen, when it's going to reopen, we are going to give our learners, our parents, the public, the specific date so that they will be prepared.
Assistant Technical Officer Tertiary Patrick Chinadu explained that the Ministry of Education is going to implement sanitization hubs and improve school policies.
The ministry is actually drafting some kind of guideline as to what could happen when school reopens, so at least we can maintain that sanitary condition. So we are hoping that pretty soon there might be a policy that guides the ministry moving forward as to how we should behave in schools. Why the ministry have had such policies before is the case we are given the pandemic. Most likely this might not be the first, so ministry have to be prepared in the event of any occurrence. So we have to ensure that we have policies and guidelines that inform as to what is going to be happening moving forward.
As part of the ministry's crisis management team, Nicola Johnson, Chief Planning Officer, said that in the long term, the use of smart classrooms and e-testing platforms will be the new normal.
We've actually started to establish smart classrooms even before the advent of the coronavirus. And so we will be expanding on that initiative to establish smart classroom and possibly e-testing centers across the country. Of course, observing social distancing protocols and those kinds of things. And we're already in the process of acquiring the software and solution for not just students, but teachers and education officers to use, because this is a new normal. This will be a new normal for us.
Public schools across Guyana have been sanitized, and the Ministry of Education continues to provide daily learning opportunities for nursery, primary, and secondary school students. NGSA practice test papers are available on the ministry's website at www.education.gov.gy. Radio broadcasts of the interactive radio instruction continue daily on NCN Radio and Radio Madia, Bartica, Essequibo, Mabaruma, Lefem, and Radio Piomac. Persons can also tune into the Guyana Learning Channel, Channel 42, Cable 29, to access the following programs. Nursery program, 6 hours to 9 hours. Primary programs, 9 hours to 12 hours. Documentaries from 12 hours to 13 hours. And secondary programs from 13 hours to 15 hours. Letitia Isaacs for InfoHub.
The Guyana Elections Commission says a new date for the national recount of the March 2 general and regional elections is dependent on the availability of the CARICOM observer team. Alexis Rodney has the details.
GCOM, however, continues its preparations for the high-level team, which the Commission said will serve as a third party in the national recount process. Preparations included a visit by the Commission and members of the National COVID-19 Task Force on Monday to the Arthur Chang Convention Center, where the recount is scheduled to take place. GCOM Chair Justice Retired Claudette Singh said all the groundwork must be done.
We need to ensure and guarantee the safety of the CARICOM team. As soon as that is finished, we have to communicate what we have done to ensure the safety to the Secretary General. The people are virtually afraid of contracting the virus. So that is why we're leaving no stones unturned to ensure their safety.
To facilitate the team, the task force has also approved team members undergoing WHO standard RT-PCR tests for COVID-19 in their respective home countries before entering Guyana. If any official is unable to have such medical tests, the Ministry of Public Health will have the tests done upon their arrival here on the condition that officials self-quarantine for 2 days while they await the results. The NCTF said on Monday that its chairman, Prime Minister Moses Nagmotu, has written to Justice Singh and CARICOM's Secretary General Ambassador Erwin Larocque to convey the decisions. For InfoHub, Alexis Rodney.
In sports, a Jamaican cricketer is among the hundreds of Jamaicans stranded in the United States. Over a month ago, Jamaican cricketer Damien Jacobs left the island of St. Kitts after wrapping up his participation for the Leeward Islands Hurricanes in the West Indies Championships. The right-arm leg spinner said he initially thought that he would just spend a few more days before he would be able to return home, but those few days have now turned into a month. Jacobs was one of many Jamaicans who were trying to return to the island before the borders were shut down by the government due to the COVID-19 pandemic. Prime Minister Andrew Holness says plans are being ironed out to gradually get stranded Jamaicans back on home ground. And that's our package. Join us again tomorrow, same time, same place, for more news and sports right here on PBCJ, the People's Station.